We'll switch things up now to our week-long series called Menopause, the change we're finally talking about. Bringing you a closer look today at hormone therapy and how it's being used to treat menopause symptoms. NBC5's Kate Chappell breaks down HRT and why some women may still be hesitant to give it a try.
If you're using commercial dosing, it may not be enough.
Are we worried about the pendulum swinging the other way and the overuse of hormones?
There's a lot of information online about hormone replacement therapy, or HRTs.
Let's talk about replacing my hormones that I was desperately missing.
And it can be hard to know who to trust. Demand is surging for HRTs, used to provide relief for common menopause symptoms. Prescriptions for women 50 to 65 have increased 86% since 2021, according to the journal Epic Research, which shares data between healthcare professionals.
So I use an estrogen gel.
Jane Mawicki started taking HRTs a year ago to treat her vasomotor symptoms in combination with progesterone and other supplements.
I was having terrible brain fog. I don't have that anymore. Happiness. Feeling good.
Initially, on the advice of a friend, she tried pellets, right-sized implants that deliver a constant, slow release of hormones. Then she had an irregular mammogram, so she stopped, and it was back to the drawing board.
I didn't know what was going on. I had no idea. I wasn't told this is happening, but I definitely was a different person. I had anxiety for the first time in my life, which is a symptom. My body started to change.
She found Dr. Christy DeSapri at her gym after she gave a talk about menopause. Dr. DeSapri helped her find the hormone formulation that worked best for her symptoms. They've made a tremendous difference for the 55-year-old wife and mother of three who works full-time at a large consulting firm. She hit menopause at 52 and is now navigating post-menopause.
Did you have any hesitations about HRTs?
No, I didn't.
But many still do. Use of HRTs plummeted in the early 2000s following a controversial Women's Health Initiative study that found combined hormone therapy increased risk for breast cancer, stroke, and cardiovascular disease. Many women who participated were over the age of 60, past menopause.
We need to share a consistent messaging on hormone therapy is safe and effective. It's not for everyone. There's risk benefits alternatives like every medicine.
In November, the FDA removed black box warnings for most HRTs after updated research suggesting the benefits outweigh the risks. The study largely focused on older women who were given a hormone formulation not common today. The FDA says the warnings created unnecessary fear. But treatment should be very individualized, according to Dr. DeSapri.
Again, you're probably hearing, I need to be seeing someone who understands these options before I just choose one or pick one out of the air. Or what I commonly see is patients say, well, my friend is taking the patch, so I think it'd be perfect for me. Well, it just depends.
HRTs are the most common treatment for menopause symptoms, but aren't suitable for everyone, including those with a history of hormone-dependent cancers, blood clots, or heart attack and stroke.
If a woman is not a candidate for hormonal therapy, what are her options?
For hot flashes, particularly, or vasomotor symptoms and night sweats, we have, again, some new options in this area, which we didn't have for many years.
Including 2 new FDA-approved non-hormonal drug treatments targeting neurons in the brain.
And then they can still use local vaginal estrogen. And this is also a big part of the updated label.
Hi, Ruby.
For Jane, HRTs, Dr. DeSapri, and more open conversation have been life-changing. She's now empowered to advocate for her health, easing the discomfort of her midlife transition.
I was in a boat without an oar. I wish I had known what I know now.
A growing number of women are also turning to functional medicine to treat symptoms. Tomorrow, we'll talk about acupuncture and supplements and the mental health challenges associated with menopause when our series, The Change We're Finally Talking About, concludes tomorrow at 4.